The design of healthcare technology products has a major impact on the professionals themselves. These days what we're seeing is more and more use of computer-based systems, and the professionals, the nurses, the physicians usually are not trained in how to work effectively with those systems, and often the environments aren't designed well to actually support the work of those systems. So what happens is we're seeing that nurses and physicians are actually getting injured in quite large numbers because nobody is really planning for the effective use of technology. All of the focus is on looking at what can the software systems do, rather than also asking the question of how can the nurses and the doctors effectively use computers in an optimal way so they don't get injured over time. The pressing issues in healthcare design technology that we're dealing with at the moment are twofold. One, the software systems are changing. Increasingly, people are spending more and more of their time interacting with computer systems and less time interacting with patients. And the second thing that we're seeing is that the nature of the technology is changing. Whereas people used to be interacting with desktop computers, now they can be working with mobile devices, they can be working with carts, they can be working with tablets, they can be working with smartphones. And each of these different technologies has implications for how the person effectively can actually use that technology without getting injured.
What are the hidden challenges for the physical environment that affects healthcare?
The hidden challenges for the physical environment that affect healthcare professionals actually stem from how they can use technology. One of the problems is that if you are in any level of discomfort, then you're going to be distracted. One of the concerns we have is we want to reduce medical errors, and the source of those errors is often a human source where a person actually enters incorrect information, chooses the wrong drug, deals with the wrong patient, and all of those can be impacted by physical discomfort. Why might that discomfort arise? When we look at data on nurses and physicians, we find that in poorly designed environments, anywhere between 60 and 80% of those people are frequently experiencing pain. And it's very hard for you to focus on your job if you're actually in pain. So we want to reduce medical errors, we want to improve the health and well-being of healthcare providers, and we want to increase their capability to effectively use some of the new technologies that are coming along. So some of the technology changes that we're looking at are technologies that are going to reduce the chance of things like adverse drug events. For example, medications now can be put into medication carts where software systems can actually check that it's the right medication that's going to the right patient with the right dose. They can check that there are no adverse drug interactions between different drugs that are being delivered. And all of that can be automated up front to greatly enhance the capabilities of nurses to deliver appropriate care to patients. And that information can also go into a technology system so the physician can monitor the progress of that patient and can quickly determine whether or not they need to change the therapeutic regime or whether things are working effectively. So what we're going to see in the future is greater and greater involvement of technology in actually amplifying the capabilities of healthcare providers and dealing with the deficiencies of human brains, because no one person can know all the diseases and all the possible therapies that we can currently apply. All right? Cool.
Thank you so much.
Great. Okay. One take. Thank you.